Good evening, Endo Summit Live, and welcome to this fabulous night where we are discussing many things all about your central nervous system, but really taking a deep dive in how the brain and your body connect and why with endometriosis it is so important to understand that there's more out there than just surgery. And we even are joined by a surgeon tonight, Dr. Vidali. Welcome, welcome.
Good evening.
Yes, so our speakers tonight is Dr. Susan Clinton. Susan, can you introduce yourself?
Sure. I'm Susan Clinton. I've been a physical therapist and a health and wellness coach for some time now. And my big thing that I work with clients is stuff about their central nervous system, because it's the backdrop of everything we do. And we're going to be talking a little bit more into a deeper dive into how to make your sleep better tonight.
Yes, we are talking about how to make your sleep better tonight, because sleep should be better for everyone, but also because you will join us during Endo Summit surgery on March 24th for a lab all about sleep and endometriosis. Is very exciting. Also joining us tonight is Dr. Juanita Benedict. Juanita, do you want to introduce yourself?
Sure, of course. My name is Juanita Benedict. I am the owner of Athena Pelvic Therapy. I've been doing pelvic floor physical therapy for, like over 10 years now. And I'm also a certified hypnotherapist. And so I definitely work with the central nervous system and how our body reacts. And we use what's going on in our minds to help control that all the time. So I'm excited to be here tonight and talk about this.
It is amazing. Okay, so let's start with sleep. Susan, you chose this topic. Why is it something you're passionate about? Uh-oh.
That's okay. I just missed your thing. So I assume you want to know what are some important things about sleep and why it matters?
No, I wanted to know why you're so passionate about sleep.
Oh, okay. I'm passionate about sleep because if you think back into the dark ages of time, the best way to torture people was not to let them sleep. Sleep is essential for our bodily functions and for us to maintain homeostasis and to feel good, but also for us in any world that we live in. Sleep is necessary for our functions that happen behind the scenes, to have our brains quiet enough to allow those to take place. It helps with hormone balance, which helps us stay awake during the day and rest during the night. But the most important thing that it does is it really helps support access to serotonin. And why does that matter? Even if you don't know what serotonin is, you know that the story, the day before you go to sleep, things have happened. There's several things going on. You're asking yourself, how can I possibly get it all done? It's not going to work. This has happened. This has happened. The whole world essentially is kind of blowing up in your head. Then you go to sleep and you have a good night's sleep and you wake up the next morning and you go, what was I worried about? This, it all works out fine. Let's go. So that's the difference between running in the negative hormone cycle versus getting enough access to the positive hormones, which are going to help us feel joy, feel happiness, feel rested, and be prepared to handle the stresses of the following day coming up.
Yes, it's amazing. And hormone regulation and sleep, very, very, very important. So somebody comes to you and you do your interview, which PTs ask about a lot of things, but do you ask about sleep? And then where do you go from there, depending on their answers?
So yes, as a coach and as a PT, I definitely ask about sleep. And it's been something I've been doing in the world of chronic pain and chronic conditions for a long time, because it's one of the things that I hear my clients complain about. If they're not complaining about sleep, they're complaining about bowel function. So these are the two most important things that come up. So I do ask about sleep, and I actually give everybody sleep inventories. It takes into a deep dive of like, what do you know about sleep and how much sleep are you getting and what do you feel sleep is? But the most important questions I think for people is, how do you feel in the morning when you wake up? That tells us way more than what's actually been going on at nighttime. So I really want that story, because what I do with people with sleep is kind of do a little bit of reverse engineering. Instead of what's happening at night and how can we mitigate that, it's what's happening in the morning and how can that help the following night and the following night's sleep. So those are important questions to ask, because it leads into stuff I know Juanita is going to talk about, which is, balancing that central nervous system and, being able to pull it together and really get them to focus on, I need 8 hours of sleep and being stressed over that. Instead, it's like, how much sleep do you need to feel good? And, when was the last time you woke up and felt like, yes, I'm ready to go?
Dr. Vitale, when was the last time before the first kid was born, maybe?
Yeah, exactly.
Yeah. So let's talk about that. What I was reading, we're going to run some content tomorrow, but I was reading all about the things that make morning important. Can you talk a little bit about that for us tonight?
Yeah. So the first thing that we want, if we're talking about hormone regulation, is we want to be able to suppress melatonin in the morning so that we are awake and ready to go. And there's ways to do that. So I'm going to kind of talk a little bit about the circadian rhythm, because not the word circadian, but the word rhythm, because rhythm is what's important. And that's what's important for hormone balance. And, we're not just talking about estrogen, progesterone. We're talking about cortisol, melatonin, serotonin, oxytocin type of hormones. And so in the morning, it's important to have an established routine. The rhythm, when we use the word rhythm, it just means that hormone suppression and hormone expression happen around timetables. And the timetable in the morning is to be awake. So we want to do things that are going to suppress the melatonin and the hangover effect and begin to bring in the idea of this is the awake time. So there's many, many things we can do. One of the easiest is to get outside and get some sunlight in your eyes. That tells our body we're awake. It tells us that the sun is up and that it is time to start generating the activation hormones to get us rolling and get us going. There's a lot of other things we can do in the morning too. It's interesting we're talking about this in the deep, dark days of January, because we have limited daylight hours and daylight exposure. So as soon as you can get daylight into your eyes, do it. But if you wake up and it's still dark outside, there's still plenty of things you can do.
Now, what do you
One is to wake up at the same time every day, no matter if it is the weekend. So you really want to establish a wake up time and stick to it, because we're talking about regulating rhythms. And when you get up, your morning routine should, exist of a few things. One of them is something that you look forward to. So that could be a movement piece, a meditation piece, or it could even be something as simple as eating something that you really want for breakfast, so that there's a motivation piece there that can really draw that up. And that's, so that's super important. Exercise is great because it begins to move the body and tells the body and brain that we're awake time. We're actually doing movement. The movement doesn't have to be hard. It doesn't have to be a high intensity interval training, but the movement needs to occur at that time, even if it's a simple walk around the house and opening windows and, doing a thing that's a pattern to begin to help establish that routine and rhythm. Those are really, really important to help bring this issue forward. And a lot of people don't do that. A lot of people keep hitting the alarm and hitting the alarm and hitting the alarm until they can't. And then they jump out of bed like a racehorse. And they're running around like crazy, trying to get everything done really quickly because they slept too long. So they're yelling at themselves inside their own head about how bad they are. They should have gotten up earlier. Now they don't have any time. So it starts that whole kind of stress cycle to start the day. It would be better if we could start our day in a little bit more of a quieter mode. That could include, just having a warm drink or a cold drink. Some people really like the idea of a spritzer to wake them up, which could be a little apple cider vinegar and maybe some green powder or some lemon, juice with it, whatever makes you happy, whatever kind of helps you kind of begin to come awake and come alert. And that's why we talk about those circadian rhythms. And what we do in the morning is, if we can establish the wake up routine and get it set, it's going to be much easier to reverse engineer the nighttime piece and what time you really need to go to bed to be able to arise at that same time to wake up every day. I think in modern world where we miss the boat is we have told ourselves the story that sleep is cumulative. So if you miss it, you can catch up on it. And we can do that and adapt for a while, but that's not a sustainable practice over time. And it's, so a lot of people will burn the candle at both ends, knowing that I can sleep till noon on Saturday or till noon on Sunday. But actually what that does, it makes them even more fatigued and tired on Monday, or whenever their next alert, early alert day needs to be, because they've gotten themselves out of the timetable of the rhythm. And so the hormones are leaking over from one area to the other, and it's harder to suppress that at that time. I think the really interesting thing about this is with endo is a lot of our clients with endometriosis are beginning to have symptoms even in their teens, as we all well know. And the melatonin cycle for teenagers is very different than it is for adults. And it tends to not kick in until much, much, much later in the evening, and last a lot longer in the morning. And when we already have disruption with the chronic symptoms, heavy bleeding and the fatigue and the pain and things that come along with with endo, then that can really impact melatonin suppression and or melatonin activation at different times to fit in with school hours and college hours, and then lifestyle with young families, or just jobs and things that require different hours than our bodies can really wake up to. So being kind and gentle and finding the place to start can actually be the time when we need it the most, which is the morning.
It's very interesting. Very, very interesting. Now, what's your opinion of the, especially in the dark wintertime in the Northeast, the sun? I've had doctors say that you can use, there are special lights and you have that one come on, say at 6 to 7, so that, your eyes are being woken up by sunlight. What do you think of something like that?
I think those light therapies can be very, very helpful, especially for people who are really having trouble suppressing melatonin earlier in the day. So those can, for a lot of people, even just a cloudy day or watching the sun come up a little later in the morning during those dark times can be helpful. But for people who are really dragging and really having a problem, being able to have a light that they can switch on, or maybe even comes on by, an alarm can trigger it. Some of the light therapies include red light and some of the other lights. There's a bunch of them out there. They're not harmful because they're not, bringing in like sun tanning equipment that can, mess with our dermatome, with our skin. We don't want anything to do that. But those light waves can really be helpful to stimulate the brain to start suppressing the melatonin a little bit earlier. And for people who are suffering, like really suffering with, seasonal affective disorder, or just really dragging hard and fighting fatigue, those can be very useful and very helpful.
I have a practical question.
Yes.
My wife has been conditioned since, she was very young to sleep in absolute darkness, like not even a sliver of light. Terrible sleeper. And, I always tell her, look, this is crazy. Why do you have to sleep with this like thing? This is not good for you. But of course, now it's like, too late. But she seems to believe that this is a good thing. I don't know if it's but I know, being Italian, in Italy also, people have a tendency to make it very dark. Whereas here in the US, we don't have that because we can't make our room dark. Unfortunately, there's no way. You can never really make them dark. Unless you have those curtains. What's any one of the two panelists, what's your opinion on that?
So my opinion on that is that it's going to vary by person to person. I gave myself the story that man slept under ambient light for, millions of years. But the truth is, they actually crawled into a cave or a very dark hut and went to bed because of the light piece that, because they were so dependent on their circadian rhythms, because they were in balance more with the way the earth went, because they didn't have modern technology to assist them along. If somebody is very sensitive to light, and sometimes it can be just a little red light on the TV can be enough to stimulate some people's pineal glands that can actually wake them up in the middle of the night. And I think that if that is your situation, there's many ways you can do it, and you don't have to change the room. One of the things I would suggest is if you have a TV in your bedroom, just unplug it. You don't have to move it. Everybody freaks out like, I have to move the TV. I don't know where to move it to. It's like, just unplug it. Leave your phone outside the room. Get yourself an old-fashioned regular alarm clock that works off a battery. But the biggest thing that I think people can do that really helps is find yourself the most luxurious silk eye mask that you can. It is a game changer. Don't get one of those really rough cotton ones that scratch your face and make you feel bad. You can get a beautiful, beautiful silky mask that's just luxuriation for about $11. Pull it down over your eyes and the whole world goes dark. And for a lot of people, that can be just a major game changer. So you don't have to worry about if there's a sliver of light coming into the room, or, if the sun's coming around at a different angle that hits you right in the face in the morning, or if you're like I am right now in a hotel room while we're building our house, I can't mitigate all the lights that are in the room, on the little flashing thing with the shower head, in case the hotel catches on fire, or the TV red light, but I can pull that mask down. And that can really help, make a difference there. So it depends on the person. Other people can sleep very, very, they just have the tendency to fall into a very deep sleep. And they're able to do that, and that's okay. We just need to work with what the limitations and the struggles are of the person right in front of us, and know that there's probably a solution, but it doesn't have to be a very difficult solution. It can be very simple.
My wife will be very happy to hear that.
Mm-hmm.
Texted me, there you go, it's normal. She's watching this.
I always think needing to sleep in a completely dark and completely silenced room is the privilege of the older child, because the young or the only child, because the younger child, wherever they put you, that's it. I can't sleep. Oh, that's too bad. Yeah.
Mm-hmm.
Yeah. What is it, Juanita? I promise. It's so interesting. I promise you're next. So what is the relationship, when people go through, this is taking the lid off the box, but when people go through menopause, sleep is often changed. Let's leave it at that. What is the relationship to those kind of hormones and sleep?
See, I'm really interested in this. So
yeah,
I will definitely be quiet for that.
By the way, she has a great podcast. I don't know if you remember the name of but she has a great podcast, which told me there's no shame in a nap, by the way.
Yeah, 100%. I totally believe that. So the biggest change, and for our clients with endo who may have hormonal fluctuations, and some of you may have been because of surgical needs, have been kind of thrust into what we call medical menopause, which is a sudden change. But basically menopause is the time, or the perimenopausal phase, and into menopause is a time where we really learn to live without estrogen again. Now we can do this because we lived for a long time without it before. Before we moved into puberty and our childbearing years and those types of things, we can live without it. Women live decades in menopause, and it's a very stable time. It's just that it's going to be different. And so when we start to lose and the estrogen goes down and it comes back up and it goes down and it comes back up, the thing that wakes us up more than anything is going to be the temperature fluctuations that occur in the vasomotor, the hot flash, big red skin face, things that occur that happen at that time. Covers come off, the covers go back on. We're hot, now we're cold. We're hot, now we're cold. And it's the temperature regulation that shrinks during that time and really causes the biggest problem. So some of the things that work well, of course, is what Juanita's going to talk about. Man, balancing that central nervous system is so key. Eating foods that are non-inflammatory or less inflammatory, having a nice movement practice really changes the vasomotor expression of menopause, which is important. So all of those foundations of health are there. The other thing that works really nicely is if you go to bed cool, you're likely to stay more cool during the night. So a warm, hot shower at nighttime that may have worked when you were 25 isn't probably going to work when you're 58. It may need to be a cool shower. And I know Juanita's going to talk about vagal toning, so I don't even want to like get too far into it, but getting some cold exposure onto your head in the morning can actually change vasomotor symptoms at nighttime, because it brings the system down into a little bit more regulation. Now, people can be terrified of cold water. I get it. So if it's first thing in the morning and you're taking a warm shower, take the warm shower, but just gradually cool it down and see if you can get your head in the cold water for at least 15 seconds before you get out. Talk about waking up, suppressing melatonin, and being, in a good place. That can be very helpful. Where I live in northern Michigan, all I have to do is half the year is just go stand outside for a minute, and I get all the vagal.
What's interesting?
But
the summer I stayed in Miami, helpful. And it never got cold out. I didn't flash once because you're hot all the time. You don't even.
Yeah.
It's a steady state.
Mm-hmm.
Yeah, you don't even notice, right? Because I'm in Florida, so you don't even notice.
Mm-hmm. So, my grandmother, used to always tell us, because I grew up in hot, sweaty Texas, and people always handed us a hot drink in the summertime. And I never really understood why. And they said, you're not going to sweat if you have a nice warm drink. It's only people who drink ice drinks that are sweating and feeling miserable. It's like, really? So it's interesting what people do to adapt and change to their times, because as you say, in Florida, it's pretty much the same all the time. So am I really having a hot flash, or am I just hot?
Right.
Because there's a muggy blanket outside.
Now, we do have a small partnership, just to add this in there. There's a company called Rest Duvet, and they've engineered sheets and a duvet to help with that wick away sweat, which I'm very excited to see how that unfolds, because that was, we do it when we wear workout clothes, but I think it's like genius to put it in a sheet. I know.
And there's companies that make bamboo pajamas that are more breathable. There's a lot of beautiful products out there that can really help. But, getting to the foundation of it, it's going to be, watching what foods, you'll know immediately what foods make you feel inflamed. Get rid of your trigger foods for a while. You can introduce them back in again as you feel better. But, when you're in the throes of it, decrease the trigger foods. You know what they are. Everybody does. And look to like getting some movement in. More movement can really help the vasomotor response, because if you think about it, when we move and when we exercise, we perspire, we sweat, we do these things, we get muscle pumping action, we get hormonal benefits from exercise that can actually last into the night for us. So those don't forget the foundational health pieces too that can really help as well.
Now, what do you think? And Juanita, I'm sure you have an opinion on this as well. The phone by the bed with the scrolling before, but I mean, you should see the research. Dr. Vidali, have you looked at the research on that before? So
there was an interesting article just this week on the Wall Street Journal about it, that was, it's not a scientific article, but it got a lot of attention actually.
Mm-hmm. So any opinion on the phone next to the bed?
Go ahead, Juanita.
I was just going to say,
I'll tag with you. Go
okay,
right ahead.
We'll go back and forth. That's fine. Yeah. I was just going to say, I've been doing actually a lot of extra reading on distraction, specifically on distraction. And of course, the main product of our time that creates this distraction is our phones, right? And one of the most interesting things, the rise of anxiety levels that people have when their phone is not around them anymore, because we have changed our life in such a way that the phone is integral to everything we do. And so there can actually create a lot of anxiousness with the phone not being near the bed, although it also creates a lot of distraction. And if you do wake up, and I'll admit I'm guilty of this sometimes too. If I wake up, then I will grab my phone just to see what time it is. And then before I know it, I'm like scrolling on Facebook or something dumb. and I'm up for 3 or 4 hours. So really, if we can get rid of the phone, I agree with everything that Susan said. And, I need to get an alarm, like an actual alarm clock, not just at night, but throughout the day, to try to decrease your dependence on that phone. But yeah, I mean, I think that Susan's suggestions were fantastic, and getting rid of the phone from the bedroom is probably one of the best things that I would imagine that you could probably do for your sleep.
Right. And I would agree with you, Juanita, baby steps. You can't, the point is not to stress people out. So if we take everything away, then your system is more stressed from that than it is from like doing it good. Can you bargain with yourself and say, can I put my phone on airplane mode? So that if I wake up and I look at the time, I put it back down, because otherwise I have to like take it off of airplane mode and do this. Where it gets tricky is for people who are raising teenagers and and young adults. I totally get this, because we've conditioned them to check in with us. And that may be the only means we have to like check and see the text message came through, they're at so-and-so's house or whatever. That's perfectly understandable, but we have to kind of like begin to think about so is it really a phone or is it an informational device? And so maybe redefining what it is. Can you use your phone as a phone, or do you need to use it as an informational device? And if you need to use it as a phone, can you turn off your notifications? Can you turn off all the other stuff so that if something does ding, it's like the phone is family or somebody trying to call in, or maybe Dr. Vidali, maybe, the office service calling, and he's on call that night. For any of us. And I think sometimes we just need to kind of almost look at the situation and help people mitigate it so that it's not an all or nothing. Because I loved what you said, Juanita. It could be too stressful to like not have it there. And so are we creating more anxiety by taking it away or forcing them to take it away? Because it's never sustainable when that happens. But if we could look at it like, what is it for? And can you turn this piece off so that the only thing that would happen at night would be that call coming in that you're waiting for or expecting or not waiting for and hoping doesn't come in, whatever that may be.
Yes. The phone, it's interesting. The articles that talk about TikTok being a dopamine seeking behavior. And then for you to talk about sleep, sort of encouraging serotonin, and it's all a balance of those particular hormones. Exactly. So shifting gears just a little bit. And again, if you have questions and you're logged on here, you can put them in the Q&A section. If you're on Facebook, we will check those questions as well. Juanita, you wrote an interesting sentence to me when we asked you to talk a little bit about mindfulness. You said the brain is the ultimate interpreter, and it can be the first facilitator of pain. Do you want to explore that a little bit for us?
Sure. So one of my areas of interest has been pain management for patients for many reasons. People come to you and they have lots of these pain experiences, and any healthcare professional or provider, we struggle with how exactly to help patients in this way. And one of the things that I wanted to do was delve a little bit more deeply into the pain science, which is fantastic. But we are still learning so much about pain and how it reacts, how our body reacts to pain, and not just our body, but our minds, and how it really affects every component of our life, sleep absolutely included in that. And if anybody's had any kind of pain, that sometimes the nights are the worst, because that's when your mind is quiet and those alarm bells just go off in your brain all the time. Like, I hurt, because everything else is silent. So I studied a lot of pain science, still studying it. Anything that is that way, I love to get into that. But there comes a point when we have to go a little bit deeper, because there has to be more to it. And so that's where I decided to learn a little bit more about hypnotherapy and what's happening with the brain and the subconscious and what's really going on that level, because it's not just about how it happens, but it's also about how we can manage it ourselves. Like, how can we take some control over pain? As physical therapists, we're not allowed to, well, it's not within our scope of practice to really provide prescriptions for medication. So yet we're kind of the last stop for a lot of people who have a lot of pain, and they've already been through the whole pain medication regimen and it didn't work, or it's not working well, or they want to get off the pain medication. So how do we do that? That was kind of the question in my mind. And so what I've been learning through all these years and work with the patients and studies both through pain science and hypnosis is this idea about the brain is really the ultimate interpreter of pain, right? I mean, that's just the way our nervous system works. The nerves themselves are just the messengers. They're sending up the signals as to whether something is not right in the body. And if it's not right in the body, then the brain has to try to figure out what that means. And a lot of times the message that's sent back down is pain. And, what does that mean? I tell my patients, if you had a lobotomy, if you didn't have a brain, you would never feel pain. But unfortunately, you wouldn't be able to do anything else either. So we kind of need that. And we need to be able to figure out how to use our brains to manage what's going on so that you can get through the rest of life with the proper tools to go through it.
So we'll be having Dr. Beth Dupree do the science of pain at Endo Summit workshop for a full hour, which is a very, very exciting thing. And I was meeting with her last week, and she was talking about, she's going to bring us this guy that does yogic breathing for next year. I'm so very excited. But tell me a little bit about how the breath can help you modulate your central nervous system.
So there are a couple techniques, and we as physical therapists, rightly so, we really focus on breathing. And there's lots of reasons that we focus on breathing, because there is mechanical advantages, like in our bodies respond in a certain way to breathing. We're increasing the oxygen to everything. And it does help bring us from this sympathetic response, which is this fight, we call it the fight or flight response, right? It kind of forces us into this parasympathetic where it's more restful. The different types of breathing can allow you to do that. Long, slow, deep breaths can help you to bring things down. But if you need to be energized, then the quick breaths will help to get you more energized, and it will put you more into the sympathetic mode. So you can control a lot with breathing for sure. So you can control the way that your nervous system is responding to things. But that's only one of the techniques that can be used. Another one that is really super simple, even easier than breathing, is just simply to close your eyes. Of course, you can combine the two. But our brains and our whole bodies and nervous system, are on high alert all the time. And 80% of the information that we're taking in is visual. So if we just close our eyes, then that gets rid of 80% of the input that's coming in and allows our brains to go into a different type of operation. It literally changes our brain waves from a beta, which is what we're in right now. We're talking, we're conscious, we're, having these great conversations. But just by simply closing your eyes, you'll notice there's a shift almost immediately, because you go into what's then called alpha waves. You don't do anything else, just simply by closing your eyes and reducing the amount of input that's coming in you or into your brain all the time really makes a big difference. And that also will help you move from that sympathetic, high nervous, anxious state to more of a parasympathetic, relaxed state, because no longer are you receiving all of these images. So that's another technique. So if you do them both together, that's even better, right? The breathing and the closing of the eyes. Then you can even go into another different brainwave state called theta, and that's more of that hypnotic state.
Juanita, on a practical level, how do you work with people on breathing? What is your methodology? How do you work with people on a practical level?
On a practical level, as soon as you walk into my office is designed for this type of work. So my office is not clinical in how you would imagine it normally to be. It's more spa-like. I have lavender going throughout my office because it smells that way. My sheets are super, super soft. And I use like cloth sheets for people and not like plastic sheets. So it's all about the environment first to sort of disarm that nervousness, right? Because pelvic floor therapy is a very intimidating experience for a lot of people. And I understand. And by the time, again, that they get to us, they've gone through so many things. And they've had so many, you've had so many negative thoughts put into your mind. And you've gone through all of these doctors. You've read all of the social media posts, all of the negativity. And so on a practical level, when people walk in, they need to be in a space that kind of lets them leave all of that outside. But then one of the things we talk about for sure is we talk about breathing. So we will talk about how to breathe slowly. There are different techniques, right? Some people will say breathe in for 4, hold for 3, out for 4, out for 7. I don't know. I mean, the science behind it, I guess you could probably have an argument for any of the counts, but really it's just about you should feel the shift. You will feel the shift once you start breathing properly. And that's important. So really being able to be in tune with your body and understanding when you're shifting from one to the other is important. And it's the same like when you're going to sleep, right? I mean, just to tie it back, like you will know, you'll shift down, you'll feel yourself shift from one state to another, like semi-awake state, to then this, you almost don't realize when you fall into that delta wave or that deep sleep, just because, but you'll notice yourself falling into those deeper waves.
Now,
yeah, I love that. I think that's so important, Juanita, especially, but the practical application. And I think the idea is that, like for sleep, one of the best things you can do is use breath as an anchor.
Yeah.
So you don't pay attention to the quality of your breath. You don't pay attention to the length of it. You just label it breath.
Yes.
Breath. And if you wander in your brain, you label that. And then you go back to labeling breath. So that's a practical thing that works really well in sleep, is to use breath as an anchor. So foot itching, breath.
Yeah.
Breath. Today, annoyed, breath.
Yeah.
And just keep pulling back to, and that's a lovely way to do exactly what you're talking about, of getting down into the delta waves by not judging, not thinking, just label it and go back to your breath as an anchor.
Right. And then if you're trying to change your state anyway, you don't want to have too many things on your mind. You don't want to be like, oh, am I breathing in for 4 seconds, holding for 3 seconds and out for 4? I mean, there's a time when counting is good, right? And that's appropriate. But when you're trying to go to sleep and you're waking your mind up and keeping it awake by doing this specific task, instead of just letting your body do what it naturally should be doing, right? The breathing in and out and realizing the role that the breath as an anchor, as you're calling it, Susan, that it can play in helping you to just change and shift your states down to a more relaxed thing. I will have people do the progressive relaxation too, right? Where you feel that breath come in, and then you're tightening muscles, and then you're letting the breath help you to relax them as well. That's a good way to also change.
Well, Anita, can you talk to us a little bit about hypnosis? It's a topic that's fascinating to me. And one thing that's fascinating to me, and I don't know if I'm saying something that's correct, but I always had a feeling that hypnosis works only for things that you want. The example is that it helps for phobia of flying, because people want to fly, they want to go places, so the hypnosis works for that. But for example, smoking cessation doesn't work as well because people enjoy smoking, so they really don't want to stop doing what they like to do, which is ultimately smoking. Is there any truth to that, or is it just me just being silly about it?
No, I mean, just like everything, right? It becomes complicated as everything does. But on the face, yeah, that's correct. You can't hypnotize somebody to do something that they don't want to do. So as much fun as I could have making people quack like a duck all day long, it won't happen unless they really want to quack like a duck. Yeah, you have to have some internal motivation, even if it's just a really strong desire, because you're talking about dealing with messages in your subconscious that have been in there for a really long time. And you have to go into your own subconscious and be able to look at them in different ways and process them in ways so that you're able to change that ideology. And if you don't really want to change those ideas, you don't want to shift that ideology, then it's not going to work for you.
I sometimes feel the same way about surgery and endometriosis. I know that's a controversial statement, but if healing is a journey, and if you just want to lay on a table and have somebody cut something out of you, you're probably not going to get that much from that. That can't be the only thing that you're doing because there is a subconscious involved, and there is a central nervous system involved. And that doesn't mean that everybody doesn't deserve care. Everybody deserves care. But I also think, you have to want to heal as well. Now, Susan, I've taken your class, and it's not increasing sleep could be about breathing, taking 5 minutes, taking 2 minutes anytime you have in the day to take a minute to breathe. Can you talk a little bit about that? Because I think some people have that personality, myself included. It has to be 5 minutes, and I have to have diaphragmatic breathing, and I have to do it at 9 p.m. But it really could be any time during the day, right? Dr. Vidali.
100%. And I think the biggest thing is that we have to look at this as what we're doing. And Juanita set this up beautifully about this, is like, how can we get our brain to change? How can we get our brain to manage and do something different? So it's overcoming classical conditioning. That it's like the people who say, if I can't exercise for an hour, what's the point? Which actually we have science that proves that if you could exercise hard for 1 minute 3 times a day, you're going to get the same benefits of an hour. And so it's just overcoming classical conditioning in a way. But here's the thing: when we stop and we pay attention with great sensory attention to a process, we actually trigger. So for us to think about this a little bit, we trigger the part of our brain that Juanita talked about having a lobectomy. There's a little part in our prefrontal cortex that we trigger when we pay attention with our senses. So breath is a beautiful one because it's easy to access and it's primary. We don't breathe, we don't live. So, that's the easiest one to access for us. When we do that, even for 2 minutes, a few times a day, we start building the neural pathway over to the area of our brain where we can access oxytocin, serotonin, and the endorphins, all of those types of things that are important. The more we do that, it's like following the idea that there's a car going downhill. Every day we wake up in the morning, we're at the top of the hill. By the end of the day, we're at the bottom of the hill. How fast do you want to get to the bottom of the hill? Do you want to get to the bottom of the hill and crash and burn? Have a train wreck on the way? Or can you put the brakes on a little bit all throughout the day so that we glide into the bottom of the hill at the end of the day? And that's where that comes in, because it just basically comes on, fires up that neural pathway again, allows us that access, closing your eyes. I love that. Just the simple idea, close your eyes and just listen to the closest noise that's near you and the one farthest away, or close your eyes and reimagine something with great detail, just for 2 minutes, reimagine a success, reimagine doing something different that you wished had gone differently. When you wash your hands, clinicians, pay attention. So how many times a day do you wash your hands, Dr. Vidali? I mean, a lot, right? If you paid attention, like if you made that your time to like have full sensory attention to the temperature of the water, the soap gliding on your hands, how your hands feel touching each other, all of that beautiful stuff for that minute, and you did that, 15, 20 times a day, you are like, you're killing it. You're like building that pathway and getting over there. And it's such a great boundary. We have our clients do something every day. If they can do it with that great attention that Juanita was talking about, then that's something that they don't have to think about stopping and doing something. It's just that put attention onto what you're already doing, brush your teeth with such attention, chew your food with the amazing ability to taste everything that you're chewing. Slow it down for just a minute or two and really experience it. It can be very helpful.
Oh, I'm sorry.
Go ahead.
Just to hop onto what you're saying and to put a little bit more of a spin on it is when you were talking about washing your hands, one of the things that we talk about a lot, especially with people who are in pain, is don't focus on the sensation of pain, because that's a very abstract. Like your brain doesn't really understand what pain is. Instead of calling a sensation that you're feeling pain, try to identify it, right? Really bring your attention to it. Where is it? Is it sharp? Is it dull? Is it familiar? Is it new? Like even give it a color or a shape or some sort of tangible thing that maybe eventually is something that you can work on controlling and shaping and whatnot, but just getting that attention, it changes your brain state from being, oh, pain is something I can't control, it's just this abstract thing, to, oh yeah, it's something I understand now, right? This is familiar to me. And then we can work within those bounds to kind of change that. So the language that we use is really important too, because pain has that, it has very negative connotation to it, right? If you think about pain, there's nothing good. There's rarely anything good associated with pain. And then you as a person have experience with that, and emotional experience and physical experience. And even if we just think of something, we have physical reactions to that. So like today I was thinking about my dad when I was a kid. It was snowing. We were in Kentucky and I didn't have a sled. And so he tried to make a sled for me out of a cardboard box. And he was dragging me around the snow in this cardboard box, right? And even now, me telling you the story, like I am reliving that story and I'm smiling and my body is responding to that in a positive way, because that was a very positive experience for me. And the language that I use is very endearing. But the same thing can be true with negative experiences too. So if we take pain and we change the language around it to something new and something novel and something that we can put our hands around and our heads around, then we're going to be able to control what's happening a lot more, or at least understand it. Even if we can't control it, we can understand it more. And once we understand something, then we have the power to do something about it. So I just
last year we held
Sorry, Sally, please.
Last year we held an entire workshop on the language of pain. Okay. And I'm going to make this clear. We're not saying use different words so it doesn't hurt. We're
No.
giving you practical solutions as you try to piece through your journey. We're not saying your pain isn't real. We're not saying your pain doesn't matter. We understand that you've been minimized, but we're giving you other tools in the toolbox that you should be able to access when you need them. Go ahead.
Yes, absolutely. Thank you for clarifying that. For sure. It's not that the pain is not real or anything. It is real. When I say it's abstract, it means that our mind doesn't understand everything. Something like, if you think of like Picasso's or something, like it doesn't always make sense, but when we bring it to a level that it does make more sense to our mind, then we are able to tell our healthcare professionals more about what's happening in our pain, right? And that way we're able to communicate better with not just ourselves, but everyone else who's in the team to try to help us through. You're right. It's a very practical tool to try to advance what we're experiencing and to be heard as patients so that people know what we're actually going through.
I would have to say that it's a very interesting concept, but I think that I would have to talk to somebody. If I was in a position that I would want to use this tool, I would have to work with somebody for a long time before I would try to figure that out, because I'm not sure that I would be able to figure it out on my own, to be honest with you. This concept that you just expressed, it may be hard. I would have to talk to somebody to figure that out.
It is difficult.
So good. There's a whole profession.
That's what I'm saying. Yeah. No, of course. But I'm trying to say it's hard for me to, rationalize it and apply it. I would say I can understand it intellectually what you're saying, but somebody would have to teach me. That's what I would.
Which is what I like about the breath, because nobody has to teach you how to close your eyes and start to breathe. We come born that way. Mm-hmm. We're able to do that since we got here.
Yeah. And I like what Dr. Vidali is saying too, because Sally and Juanita are saying, close your eyes and breathe. It's easily accessible. It's hardwired into our system. And then the other part of that is that how do I remember to do that enough and often enough to make a change? And that's where the other support comes in. What support do you need as a person to be able to actually effectively apply this? And what can you stack it with, like habit stacking? Can you do it like at this time? Can you do it at this time? Can you make it happen? And how can we change the mindset? Does it have to be like this long, lengthy 45-minute meditation, or can it be 2 minutes at the moment? And all of those things are, the idea is that we have simple things we can use to get better at it. We all need support, just like, to do anything, we all need some level of support and resources to understand how we can move forward with it. And I think that that's the biggest part of it is what can you grab onto? What's the action step that you can do that is so simple that you cannot not do it? And that's where we want people to kind of step into it. And once they start doing it, then they can realize, like what Dr. Vidali so beautifully said, I would need more support to really turn this into a practice for me. To get past that, I get this, I know this, how do I bridge it? And for him, he would like to have that, that bridge of support, like, okay, what's the next step? What's the next step? And let's discover it together to get you to where you feel like, okay, I've got this now. I can use this much more effectively on a daily basis.
Well, I mean, like you were saying before, Susan, right? Everything is a baby step, right? Mm-hmm. We don't try to change everything about us in one night. It takes time to develop all of these skills. And it's the breath is a great place to start. Again, I think closing your eyes is also just a great place to start to help you to center and to create that attention to detail that you were talking about before, being very focused. I do it all the time when I'm practicing, just so when I want to focus, I'm like, really, I'm closing my eyes, and so that I can feel what needs to be felt or, work on what needs to be worked on. So I think Yeah, I think that's great.
Yep.
idea.
Small hinges swing big doors.
Exactly.
So as we begin to wrap up, we have some very exciting things in March that'll feed right into this. So we have a relaxation station, which is created by an attendee from last year who felt that viewing all that surgical footage was very triggering, probably for even the surgeons. And she has some essential oils there. She set up the whole thing. And also there we'll have the Mind Vibe device, which I think you will be using it with somebody. You can't just walk up and use this thing, but it's something designed for polyvagal release. And I hope to have we're probably going to have Ann Dutch next year to talk about polyvagal a little bit. But I think so we'll have some essential oils so you can see if that brings you back. We'll have also we have added a AM centering, so you can go and have like a moment to breathe. It's not, I don't want it, that AM thing is not yoga. Although you will be sitting on these very cute yellow towels from Costco that I had to order that were delivered today because I can watch everything go on. But just different things to make sure that you stay in the moment and don't have to check out from the experience that is the Endometriosis Summit. So we close tonight the same way we close every Endo Summit live. Juanita, what are you looking forward to the most about this year's Endo Summit?
I met the most interesting people last year. So I'm really looking forward to meeting more people in general, just all across the spectrum and board. And it was just fantastic. So that's what I'm looking forward to, is just the people.
And Dr. Vitale, what are you looking forward to the most about Endo Summit? Now that you know there's going to be a whole lab on sleep.
Well, I'm definitely going to the sleep lab, that's for sure. I think that in general, one of the things that the enrichment that I've obtained personally and professionally myself, and not just professionally, but also on a personal level, is been incredible. And, I'm looking for personal enrichment as well as professional enrichment. But this is what the Endometriosis, it's a special, I really think it's a very special event. And because it does enrich people personally and also professionally. And I think very few meetings are like that. Very few events are like that.
We are 5 years old this year, so we're going to be sharing some opportunities to share your 5 years of Endo Summit memories with us. Susan, what are you looking forward to the most about Endo Summit 23?
As always, the things that I look forward to since the very first Endo Summit I attended is just being in the same place with everybody. There is no hierarchy in this summit. And I love the sidebar the conversations and feeling like you can walk right up to a group and be part of it and be welcomed, no matter where you're coming from or what's going on with you. And that to me has been the most profound experiences that I have, is just being able to sit with people and listen and share at whatever level people want to sit and listen and share. And people are so welcome and so open there because the space is set for that to be that way. And it's just a lovely space to step into and really be part of.
Aw, that's so nice of you to say. Thank you.
It's true.
Yeah. So I guess I am looking forward to seeing everybody in person and online. I also am looking forward to the day after the summit when we all go to Animal Kingdom and I can relax a little bit. I'm not going to lie. It's been a very hard 3 weeks. Next week, we are back with our Endo Summit Live webinar. We're with Dr. Fur, and we are talking about fertility. I believe Dr. Vitale will be en route to Bangkok, so he might not be joining us, but we'll be back. And we will see you then. Good night, everybody.
Thank you. Thanks, guys.
Thank you, everybody. Thank you so much. Live from the hotel room.
Susan and Sally.